anybody. Good evening, everyone.
Good evening.
All right, that sounds better. Okay, so I hereby call to order the meeting of the Community Relation Committee of the Board of Directors of NYC Health and Hospital for Tuesday, November 12th, 2024. So I'll start with the bylaws. The bylaws for the CAPS. I want you to listen very carefully. And if you don't understand something, ask. So the bylaws, section 14, committee attendance. If any member of a standing or special committee of the board will not be present at a scheduled committee meeting, the member may ask the chair of the board to request that another board member, not a member of that committee, attend the scheduled meeting and be counted as a member for purpose or quorum and voting. Everybody understand?
Can I please clarify that bylaw rule is the Board of Directors bylaw rule, not the council? It's only for the board.
Well, that's our rules, but I needed to read it to you so y'all can understand what we're saying. Am I right? Okay, okay. So you understand what I just read. So therefore, Jose Pecan has designated Ann William Isom, represented by Aaron Kelly, be counted for the purpose of quorum and voting on his behalf. So I now call a motion to adopt the minutes of September 10, 2024. I'll poll each member for his or her vote and concern. Dr. Katz?
Yes.
Aaron Kelly?
Yes.
Jackie Rowe Adams? Yes. So, without further ado, I will turn it over to Dr. Katz. And before I turn it over to him for his remarks, tonight we are joined by NYC Health and Hospital, Harlem in the house. NYC Metropolitan in the house. NYC Sideham in the house. NYC Woodhall in the house. Now, I have the honor to turn the meeting over to my Dr. Katz for his remarks.
Oh, thank you so much, Madam Chair. And several of us will be going to celebrate South Brooklyn tonight. They're having their gala. And many of us were at the gala for Gotham recently. So it's wonderful to celebrate so many phenomenal facilities and people and great things happening. I'm going to hit, Madam Chair, a few of the highlights. I always like for the meetings to be mostly about us hearing from our various great centers. But I'll mention that we got $150,000 from City Council member Stevens for infrastructure improvements at Gotham, including updates to our exam rooms. We graduated a 50th class of radiologic technologists at Bellevue, which is pretty interesting that all of us are part of also a school at Bellevue that trains people for careers in radiologic technology. We had a 10-year reunion at Bellevue for the patient who recovered from Ebola. Queens Hospital opened up a new weight management and health lifestyle program. Queens was honored for its Go Clear and Center of Excellence in Surgical Safety. Several of us were at Metropolitan for the opening of the McDonald Family Room, and I thought that was a particularly nice event because of what it said about a board recognizing where the need was. People may know Ronald McDonald House began as a residence primarily for families traveling to New York City for children getting care at Sloan Kettering. And that's a very worthwhile thing to supply housing and food and a safe place for families coming to New York City. But Ronald McDonald has also realized, well, but there are all these families with children who need things in New York City. And so opening Metropolitan is their first completely outpatient center, again, recognizing that they as a board need to go where the children are. So Elmhurst Hospital became the first hospital to offer a groundbreaking treatment for liver cancer patients in Queens. Carter, which is absolutely, if you're ever talking to a family member and there's someone on a ventilator who's having trouble getting off the ventilator, send them to Carter. It is by far the best hospital in terms of their success at getting people off ventilators, and they were recognized for that. Harlem got a new CT scanner, which will make things go faster, especially in your busy emergency room. And just looking over some, we got 11th consecutive year, the Accountable Care Organization hit its marks and produced significant savings for the Medicare program. We celebrated a one-year anniversary of providing telehealth abortion care, and we have many resources for those not engaged yet in primary care to get them engaged. Madam Chair, that's my report.
Well, thank you, Dr. Katz. We will now hear from the four facilities presenting their verbal annual report. Each presentation, now this is important for all of y'all to know. Each presentation is allotted 5 minutes. How many minutes? 5 minutes. And we are grateful for the work that went into preparing them. Thank you in advance to all our speakers for their time and commitment to the system. And we really are grateful because I know personally that a lot of work go into this, and we appreciate it. We really appreciate it. So, Ms. Abena Smith, cab chair of Harlem.
I've already been introduced. Stay on my 5 minutes. So to proceed with the report for Harlem, Harlem Hospital currently has a number of active capital projects, which include both infrastructure and equipment upgrades. Infrastructure upgrades include boiler plant upgrades, postpartum unit upgrades, labor and delivery operating rooms, and HVC equipment, among other. Equipment upgrades include a new CT scanner, which Dr. Katz just spoke to, a nuclear camera, ultrasound machine, 3D mammographic system. Next slide. Active expense projects. Harlem Hospital is also currently undergoing multiple expense projects to improve infrastructure, safety, and patient staff care. These include upgrades to plumbing, HVAC, electrical systems, and lighting, environment abatement, new doors, renovations in emergency department, and CCU to enhance patient experience. Completed 2024 projects. Projects completed in 2024 include nuclear medicine camera, Logic, ultrasound systems, Affinity CVX Ultra System, Baxter 5 CRRT machines, FlashPad, HD detectors, 3D mammographic unit system, Next slide. Patient safety. The patient safety department is involved in many culture and safety educational proactive risk assessments, and performance improvement activities over the last year. The Harlem Patient Safety Committee met monthly to review safety topics such as good catches, national patient safety goals, the Leapfrog Survey, and performance improvement initiatives. The Good Catch program continues to be successful with 162 good catches reported in quarter 1 to 3 of 2024. Harlem Hospital maintained a Leapfrog safety grade of C in spring 2024. Patient safety led safety rounds throughout quarter 1 to 3 of 2024, educating staff on different safety topics each week to improve awareness and practice. Helped formalize guidance for the Harlem Peer Review Committee, aligning with system-wide just culture standards to enhance fairness and accountability. Collaborative with workforce wellness, care experience, and HR to analyze the act on the results of the fall 2023 employee engagement survey. Focusing on improving staff satisfaction and safety culture. Revised policies on patient identification and suicide screening. Collaborative with stakeholders to create new policies on abuse and health equity, addressing critical areas of patient safety. Next slide. Frequent complaints, attitude, care, and communication are the primary areas of patient complaints. Complaints are reviewed by the Chief of Service within 3 to 4 days of submission to resolve within 7 calendar days. Patients receive a written response, a letter or email, outlining the findings of the investigation and any corrective actions or recommendations. Some examples of complaints received include patients report delays in responses to call bells or medication needs. Patients feel unclear about their care plan or discharge instructions due to insufficient explanations from providers. Patients feel dismissed, ignored, or disrespected by caregivers or providers, particularly when their concerns are not addressed or acknowledged. Complaints regarding canceled appointment and poor attitude were also received. Next slide. Issues impacting the community. Some highlights include 96% of our internal medicine residents passed their boards this year. Harlem Hospital is a center of excellence in surgical safety. Harlem Hospital is a baby-friendly institution. Harlem Hospital has received a special LGBTQ+ designation. The hospital boasts a robust robotic surgery program, received multiple gold recognitions from American Heart Association, AHA, achievements for type 2 diabetes program. Some of the challenges include Harlem's aging infrastructure and the constant need for costly repairs and upgrades. Our hospital has worked diligently to replace equipment that has been deemed end of life. New chief nursing officer recently hired. We are working to reduce costs by converting temporary workers to permanent lines. 7 seconds to spare.
Great job.
Yes, yes, thank you, thank you.
I want to use her 7 seconds. People may not realize just how impressive she mentioned. 96% of our internal medicine residents passed their boards this year. The national is 35%.
Wow. That's
Very good, very good. And I just want to commend Harlem Hospital, CAB, and Harlem Hospital just for the work and having the backs of the leadership at Harlem, because y'all going through a whole lot of trauma over at Harlem Hospital. And so, and I understand a lot of the CAB members have been out there and very supportive. So, thank you.
Some of them are here.
Yes,
Thank you.
thank you. Okay, so, Dr. Katz, you have any questions? Miss Kelly? No. Miss Jackie? No. So now we're gonna go to another fantastic cab, Metropolitan.
Thank you very much.
He's the cab chair. Hi, Miss Jones.
So, everyone, I'll just put my timer on here. Thank you. Good evening. Good evening to
Good
the Community
evening.
Relations Committee, and happy to present this report. My name is Jewel Jones. I'm the chair of the CAB. With me is CEO Julian John and other members of Metropolitan as well. In terms of infrastructure and equipment, Metropolitan is actively investing in infrastructure, technology, and innovation to ensure the delivery of clinical excellence and patient-centered care. Over 190 million in capital-funded infrastructure projects are currently underway. Some projects in progress include replacement of our MRI machines, renovation of our indoor-outdoor respite space, acquisition of nuclear camera, outpatient, inpatient rehab renovation, and our FEMA flood wall project. And I have something to say about that after, if I have time left. Infrastructure and equipment continued. We have received 1.45 million in capital funding from Deputy Speaker Diana Ayala and the New York City Council. She's been very generous in the past as well. This will be used for optometry department, ophthalmology equipment, and the infant protection system. We have also submitted a request to OFD for bond funding to support a total of 32 inpatient rehab beds at Metropolitan Hospital, ADA bathroom upgrades, operating room updates as well. We continue to work together as a CAB with CEO and senior leadership to advocate for funding to renovate the emergency department. Patient safety, patient satisfaction and safety. Metropolitan is strengthening its culture of kindness by integrating eye care into daily interactions and is providing eye care with kindness training for all staff to ensure customer service excellence. We use employee feedback survey results to improve engagement, which will boost performance and enhance the patient experience. We foster collaboration between the Care Experience Steering Committee and Patient Family Advocacy Council to improve the quality, safety, and overall experience for patients, families, and staff. Weekly rounding by the CEO, Director, and the Director of Patient Experience, and the Director of Guest Relations to directly interview patients and gather feedback. There's a wellness center, which is now open 24/7 for staff to relax and rejuvenate. Offers wellness activities such as yoga, meditation, community music, and art to promote staff well-being. Frequent complaints. Significant reduction in complaints and grievances. So complaints decreased by 30% year over year from 456 to 322. Grievances decreased by 37% from 35 to 22. Top complaint categories: access to care, difficulty obtaining appointments, particularly in our dental services. Communication issues, there's delays in answering phones, especially in high volume areas like dental and behavioral health. Continuous improvement efforts. Proactive rounding. Patient experience and guest relations staff are rounding proactively to address complaints in real time and follow up frequently. Collaboration with ambulatory care. Guest relations staff are working closely with ambulatory care administrators to resolve patient and family concerns quickly. Happenings impacting the community. Highlights here. Some highlights. Metropolitan Hospital's emergency department has received the Emergency Nurse Association's 2024 Lantern Award, which recognizes the high quality care of our dedicated staff and is delivering, that staff is delivering to our community. Metropolitan earned an A+ grade from the nationally recognized Leapfrog Hospital Safety Grade Program. It is the only hospital in the system to receive this distinction, which recognizes hospitals' achievements for creating a Metropolitan's NICU received the Gold Beacon Award, for excellence from the American Association of Critical Nurses, and is the only NICU in New York City to secure this prestigious designation for the highest quality of care to our smallest patients. Metropolitan has been designated the system's official acute rehab center. We are adding an additional 12 rehab beds, and there's a correction from the previously submitted document. Metropolitan, as Dr. Katz referenced earlier, the Metropolitan Ronald McDonald House Family Room in pediatric OPD was completed. This will provide support to families and their children when they arrive for care. Challenges include there's increased need for mental health and substance use services in the community post-pandemic. High blood pressure and diabetes has a high prevalence in our community. Healthy food options, cost, and access to necessary medication for these conditions is a problem for our community that we are committed to help improve. And just some acknowledgements, we'll always will acknowledge our councilperson, Deputy Speaker Diana Ayala, New York City Council Speaker Adrian Adams, Health and Hospitals CAB, yay! New York City Health and Hospitals, the auxiliary members. And I just want to make reference to the flood wall that was it's actually completed, is it not? So I took some pictures, so just, pass these around. This is there's a lovely mural that now surrounds Metropolitan Hospital, and it will light up, right? It will light.
Yeah, that's
Yes, there's a
nice,
lovely
that's nice.
mural, so I'll pass these around. Thank you, everybody.
And thank
Great
you.
job.
Thank you. So let me say, Metropolitan, all the accolades and awards that you get, well received, well received. Thank you.
Thank you.
And y'all keep up the good work. So, now, Dr. Katz, you have any questions,
No questions.
any concerns?
I love Metropolitan.
We love you.
Thank you.
Ms. Kelly?
No, thank you.
Okay. Well, I said what I needed to say, so no questions, but just keep up the good work.
Thank you.
So now we have a very special cab, Sydenham. Yay! Ms. Joyce Rivers, cab chair.
Thank you, Madam Chair, and to the board. Good evening. So good afternoon. I want to acknowledge, before I begin, two former Sydenham cab chairs, New York City Health and Hospitals Board member Jackie Rowe Adams, who was a chair for many years, and Donna Veronica Gill, who is a Sydenham cab member, and she is also on the board of Gotham Health. So on behalf of Sydenham Cab, I want to thank Gotham Health Manhattan Regional Medical Director, Dr. Morris Gagliotti,
Yay.
Dr. G, who is attending the meeting with us, and Sydenham's Deputy Director Yesenia Pabon, who could not be here tonight, but she most certainly wanted to be. So they both have shown unwavering dedication to maintain Sydenham's legacy and continue to make sure Sydenham provides high-quality health care to our communities we serve. Okife Labade, Iman Musane, and Mervyn DaCosta, we appreciate all the guidance and help you give us each and every day. And I really, truly do, Iman and Okemfe. Mervyn is always on point with us, so we thank you. I know I only have 5 minutes, but I have to say thank you. Okay, so get on with the report. Infrastructure and equipment. Some facilities enhancement include new water fountains are being installed at all sites with Dykeman installation being completed. New sonogram machines at Sydenham, which allows us to expand services and provide quality care to both our established patients and new patients. New EKG machines at Sydenham, Dykeman, and St. Nicholas, which will support improved diagnostics and care in the medicine and pediatric departments. Dykeman has also undergone a cosmetic upgrade with new paint job and updated signage. A larger signage project is on the way, and our sites will highlight key services such as developmental pediatrics, mammogram, nutrition, and smoking cessation. On slide 3, we have Sydenham received a rate provider Press Ganey report of 83% for quarter 2 of 2024. The recommend this provider office score was 87. These scores are slightly below the state average of 88% and 92% respectively, but show significant improvement over previous years. In quarter 1 of 2024, Sydenham received record high scores of 85% as rate provider and 89% as recommend this provider's office. Slide 4. Sydenham's area of strength include our staff performance, particularly in nursing and care providers. Opportunity areas include improving access and streamlining the visit process. Complaints have been minimal in 2024, only 7 complaints received since January 2024. Okay. Issues impacting the community. The infrastructure at Sydenham, the building requires ongoing repairs, particularly the HVAC system, which is being addressed with approved contracts and support from central office. Additionally, we benefit from expanding radiology services, but are limited by infrastructure constraints. A referral process, many patients struggle with access to specialty care not offered on site. While staff assist in making these connections, follow-up on appointment scheduling remains a challenge. A dedicated point of contact for specially provided offices could help improve this process. Accomplishments. Sydenham has been recognized as a LGBTQ+ healthcare equity leader, achieved 100% score on all criteria for human rights campaign. Sydenham has received 2024 recertification for patient-centered medical home, PCMPH, and the American Heart Association certifications. Sydenham was certified gold for diabetes and cholesterol and gold plus for hypertension. Our acknowledgements, we would like to extend our gratitude and acknowledgements to leader, New York County Democrats Keith L.T. Wright, U.S. Congressman Adriano Espaillat, Manhattan Borough President Mark Levine, Manhattan Deputy President Keisha Sutton James, New York State Senator Cordell Clare, New York State Senator Robert Jackson, New York State Assembly Member Inez E. Dickens, New York State Assembly Member Al Taylor, Manhattan District Attorney Alvin Bragg, New York City Council Yusef Salaam, President NAACP New York State Conference Dr. Hazel N. Dukes, the NYPD, the FDNY, the St. Nicholas Tenants Association, and the Dyckman Tenants Association. Thank you, Madam Chair, and that is our report from Sydenham, and I'm so glad to have Dr. G sitting next to me.
Very good. Thank you. Y'all have a lot of support there, Renaissance, so they gonna get a lot of money and get things fixed, Debbie. Yes, yes, a lot of support. So y'all keep up the good work.
Thank you.
And that is most important, keeping up the good work, on our cabs, because we cannot, Health and Hospital cannot do it without the cabs. We could do it, but we could really do it better. Is that right, Doctor?
That is absolutely right.
Well, thank you.
Okay, so thank you. Woodhall, is Woodhall in the house?
We're here.
Okay, so Miss Virginia, I want to pronounce this right, is that Robut?
Rebut.
Rebut. Will be reporting on behalf of the CAB chair, Miss Barbara Williams. Miss Rebut.
Hi, good evening, everyone. I want to just acknowledge my colleague here, that Titania's with me today.
Hello, hi.
And I'm so glad she is, because I've never done this. It's my first time, but there's always a first time for everything, right?
Yes, ma'am.
Yes. Woodhall has completed some facility enhancements, which include the fifth floor roof of Woodhall was replaced due to extensive damage caused by natural disasters and heavy rainstorms over the years. The auditorium roof was replaced to enhance the space remains functioning, so the space could remain functioning for staff and community events. Interventional radiology suite was constructed. A new CT scanner was purchased for the emergency room.
The next slide.
The next slide. Woodhall will also be replacing generators to ensure stabilities and I'm sorry, resiliency during weather events. The hospital's original fire alarm system will be upgraded. Next slide, please. Woodhall will be renovating its labor and birthing suite. Floors 9 and 10 of Woodhall will be vacated as the part of the Outpost Therapeutic Housing Units project, which will create new treatment areas for the detainees under correctional health services. Woodhall has also upgraded the Hospital Police Command Center. This project includes updated security, surveillance cameras, and other safety features to decrease the potential of security breaches and unauthorized entries. Patients' experience and staff engagement. Woodhall was awarded the Bronze Certificate by Plaintree International for excellence in person-centered care. The hospital launched its all-star recognition program to promote real-time peer-to-peer recognition among staff. The latest press gating survey showed improvements in several key areas. Increased rates for rate the hospital, recommend the hospital for inpatient services, higher likelihood to recommend for inpatient behavioral health and emergency department. WUHO continues to collaborate with PFAC, Patient and Family Advocacy Council, to incorporate patient and family feedback into new initiatives such as updating the admission package. The I Care with Kindness initiative has been launched with 825 employees signing the pledge. Patient safety. WUHO Hospital's patient safety program focuses on preventing patient misidentification, which is a key issue in healthcare. The hospital's Check 2 Every Time campaign, actively supported by all departments, promotes accurate patient identification through visual postings and regular staff communication. Patients and families are encouraged to speak up, to encourage in their care. Patients are provided no decision about me without me pamphlet, which is reviewed by the patient representative among admission. Workforce wellness. We have a robust workforce wellness program which provides emotional support, decreases stress, and promotes overall staff wellness. Frequent complaints. Patient complaints at WUHO are primarily related to attitude and behavior, particularly with staff. To address this, WUHO has implemented continuous effort, which include reinforcing attitude and behavior through training a new staff during orientation and communication matters, training for all employees. Training and collaborating with patient relations, patient's experience, and leadership for both outpatient and inpatient areas. Promoting monthly complaint data to department leaders to identify trends and drive improvements based on patient feedbacks. Additionally, following intensive in response to property-related complaints in 2022, there was a significant decrease in property complaints throughout 2023. Impacts within the community. WUHO continues to receive, I got lost there, I'm sorry, excuse me. Designation and certification of its care for Plant Tree, the American Heart Association, and U.S. News and World Report, and others, to name a few. Awarded Plant Tree Certificate for Excellence in Person-Central Care. American Academy of Critical Care Nursing Beacon Gold for 2023 through 2024. 2026. Redesignated as a baby-friendly hospital by Baby Friendly USA. American College of Surgeons recognized WUHO as a surgeon quality partner. WUHO is also a teaching facility with 5 sponsored programs and a total of 141 trainees. WUHO is now offering additional service which includes ENT, thoracic surgery, and others. Challenges include WUHO's aging facility, which is in constant need of costly repairs and upgrades to the infrastructure. While all vacant positions have been approved to be backfilled, we are working to fill all vacant positions. Vacancies are covered by agency staff and overtime in the intern to ensure patient safety. Opportunities. We are working to partner with community organizations to support patient care programs to reduce anxiety and rebuild trust. Increase transparency communication to engage to the community and highlight successful hospital stories. Acknowledgements. I'd like to thank all our elected officials for their ongoing support for the person-centered care, treatment, and services provided to the residents of WUHO.
Thank you. So just let me say, before I turn to my colleagues, just let me say, Miss Virginia, that I remember when I first started as community relation chair. So you did, that's all right. That's all right. You did it. So thank you. Dr. Katz?
Thank you.
Well, I think we should mention that Uncle Greg is retiring. You know, and he's been a very important fixture in Woodhall. Mr. Calise, he's agreed to stay until we find someone who's as great as Greg is, but that's gonna be very hard to do. You know, Greg has a lot of love, and people feel it at the facility. And so we're really gonna miss him. But we will work hard and involve the CAB in the selection of our new CEO.
Thank you, it's appreciated. He is very awesome and he is very well loved by the community.
Yes.
Thank you. Again, I appreciate everyone that's here at the table. Miss Erin, you have any questions or concerns, comments? Oh,
I didn't go over my 5 minutes, so I just want to say one thing. We also have our former chair, Everett Persons here, so I want to acknowledge him.
okay.
And all of Sydenham that came out today. And I appreciate all my CAB members and Ms.
Thank you.
Rendrita Evans. And to invite Dr. Katz to our annual public meeting again this year. Thank you.
To it.
That's your 5 minutes.
That's my 5 minutes. I'm done.
Thank you. Again, it's so important. You know, I'm looking around the room. I'm looking around the room and it's very impressive, right?
Very impressive.
I mean, to see all of you really come out, that means you care, you care, you care. And that's what it's about. Patients care and the community and getting the job done of safety, keeping our hospitals safe and our patients safe. So in order to do that, you have to come out and find out what's going on. And you have definitely proven to us that you care about what's going on. Again, all the cabs, I applaud you. So Dr. Katz have no questions. Ms. Erin have no questions. So at this time, thank you again. Oh, before I do the closing, I want to say, I have to take the chair privilege and say thank you to Gotham for a wonderful event of honoring myself and the other board member, Sally.
Yeah, it was a great event.
It was a great event. It really was. So thank you, thank you. Y'all know how to party, baby. So, is there any old business from our members? Hearing none, okay. To come before the committee, hearing none, I now call a motion to adjourn this meeting. Isn't that wonderful? And y'all kept it 5 minutes, 4 minutes, 3 minutes. Thank you for all your support. And please stay safe and well. And I'll see you the next time.
Thank you.
This meeting is no longer being recorded.